Imagine a world of healthcare without standards, without hygiene, without compassion. Florence Nightingale, the lady with the lamp, transformed this world into the one we know today. A world where the sick are not just treated, but cared for. A world that recognizes that hygiene is as important as medicine in the healing process. Nightingale, a woman of great conviction, led a healthcare revolution from the grimy halls of the Crimean war hospitals. She introduced strict hygiene standards and emphasized the need for compassion in nursing, a profession she saw not just as a job, but as a calling. Her transformative impact on healthcare was nothing short of revolutionary. She was a beacon of light in a world of darkness, a woman who held a lamp not just to illuminate her path, but to shine a light on the dire conditions of healthcare. Born in the year 1820, Florence Nightingale was a force to be reckoned with. Born into a wealthy British family, Nightingale was expected to lead a life of luxury and leisure. However, her calling was different. Florence's early days were spent in the opulent surroundings of her family's estates. Yet, she was not content with a life of idle privilege. She felt a deep, urgent calling to a life of service, a calling that would ultimately lead her to the field of nursing. Despite her family's expectations of her maintaining the social status quo, Florence was tenacious. She defied societal norms and her family's wishes to pursue a career that was, at the time, considered menial and lowly. She sought knowledge, studying nursing and healthcare passionately. Her commitment to her chosen profession was unshakable. This was not just a job for Florence, it was a vocation, a calling. Florence Nightingale was not just a nurse, she was a pioneer, a leader who would revolutionize the field of healthcare. The Crimean War marked a turning point in Florence Nightingale's life. It was during this tumultuous period that Nightingale, appalled by the unsanitary conditions and high mortality rates among wounded soldiers, launched her crusade for hygiene. She was convinced that cleanliness was a fundamental aspect of patient care, a revolutionary belief at a time when hospitals were often no cleaner than the battlefields. Nightingale implemented strict hygiene practices, transforming the military hospitals from places of death and despair to havens of recovery and hope. She insisted on clean linens, fresh air, and proper nutrition for the soldiers. Her efforts were not in vain. The death rate among the sick and wounded drastically fell, making her a beacon of hope in the dark days of the war. This tireless service, often late into the night with only a lamp for company, earned her the affectionate title, the Lady with the Lamp. Her relentless pursuit of improving healthcare conditions during the war became a beacon for modern nursing. Florence Nightingale's impact didn't end with the Crimean War. Instead, she used her newfound influence to establish the first secular nursing school in the world at St. Thomas' Hospital in London. This wasn't just a place to learn the basics of patient care, it was a groundbreaking institution that transformed nursing into a respected profession, setting the standard for modern nursing education. Beyond the classroom, Nightingale's influence extended to the corridors of power. She advised on healthcare policies, advocating for improved sanitation and the humane treatment of patients. Her relentless pursuit for change led to widespread reforms in the healthcare system. And let's not forget about her role in popularizing graphical presentations of statistical data. Nightingale was a pioneer in the visualization of data, using diagrams to communicate complex health information, a practice that is still prevalent in today's data-driven world. Florence Nightingale, the Lady with the Lamp, illuminated a path for modern nursing, leaving a legacy that continues to light the way for healthcare professionals worldwide.